Would you take a supplement if it was really good for your metabolism? What if it helped control your weight, fought inflammation, and reduced the risk of diabetes, heart disease, and stroke? These researchers wanted to see if spirulina could be this magic metabolic bullet. We know this blue-green algae has some other health benefits and have covered it before. Let's find out if spirulina is the magic bullet these researchers think it is. They took 50 patients who were obese, defined as BMI over 30, who had high blood pressure that was reasonably well controlled on a single blood pressure medication, and with stable body weight for at least 3 months. They randomized them to receive 2 grams of spirulina daily for 3 months, or take identical appearing placebo pills for 3 months. They took baseline measurements of a bunch of things, including weight, waist circumference, cholesterol, triglycerides, insulin, and insulin sensitivity. Then after 3 months of their respective randomized treatments, they remeasured everything. They instructed everyone to keep their diet and activity the same. A couple minor issues with their study methods, but there's one we should discuss in studies like these that try to look at lots of different outcomes. Ideally, we want studies to designate a primary outcome that's what they're really looking for. You design and power a study to optimize your chances of finding the quote-unquote truth with respect to your primary outcome. Then you can have secondary outcomes that the study is not as perfectly designed for, and we take those results with a grain of salt and use them to stimulate further research. Before we get to the results, please help us grow by hitting the like button and consider subscribing if you want to learn more about supplements, health, and research. Anyway, continuing on, what did they find? The spirulina group had a bunch of statistically significant improvements compared to their own baseline and compared to the placebo group. They lost a little weight and lost a couple inches around their waists. They lowered their total cholesterol and they lowered LDL, the bad cholesterol, by about 20 points. They didn't have any change in HDL, the good cholesterol. They also had improvements in their insulin sensitivity. So is spirulina a magic bullet superfood? We have pretty good data in a few areas, and it does seem to work for lowering cholesterol and improving insulin sensitivity in this study and several others. This study has a few issues though, and the results shouldn't be taken as fact. That said, it's still decent research and certainly contributes and agrees with the overall body of literature. We need to keep in mind that the results in this study are really proxy measures for the things we care about. Does lowering cholesterol mean that you'll have lower risk of heart attack or stroke? Maybe, but probably not. There are cholesterol-lowering medications that have not really shown any effect on these risks, even though they really bring the numbers down. And really, just one class of medications lowers cholesterol and reduces heart attacks and strokes. At the end of the day, we're people, not numbers. We like our research to explore outcomes that we care about, like being functional and not dying. Still, spirulina seems to be very promising in a lot of areas of our health and might be worth trying. Talk to your doctor to make sure it's safe for you, and look for a reputable and high-quality supplement if you decide to try it.